we do have questions here that will help frame discussions. The panelists may participate, the audience may participate, and if we can bring up discussion topic 1 question. This will help us in characterizing some additional discussion points you may wish to pursue. As you can see on your screen, which one symptom of NPC has the greatest impact on you or your patient's daily life? And the request is that this be reflecting your patient's particular considerations. What was the most impactful thing on daily life? So let's take just a moment to capture that. We have several questions, but rather than querying each one right now, we're going to take a question at a time. We'll look at the results. We'll keep those up on the screen while we discuss. And Lauren and Colleen are going to be moving around the room with microphones so that they can capture your particular comments or questions. So very interesting. As you see, some moving targets, and our colleagues in webinar are also able to participate, correct? Right, very good. And clearly the most prevalent responses are A and B, ambulation or walking difficulties and the complications that come from that, the falls, the face plants that we've heard about. And then cognition, being able to concentrate, think, and learn. But not inconsequential, the difficulty swallowing, seizures, and obviously there's a range of manifestations each patient may have. So given those things and what you see with the general trends, which will be captured as part of our Voice of Patient report, we would invite comments, questions, anything from those of you either on the panel or in the audience. And again, focusing on this particular point, the most daily oppressive issues. Any brave souls care to step forward? Alex is going to help us, and then Brad.
Hi, my name's Alex Kajine. So what I suffer with speech problems sometimes. Like I repeat words more than once. Yeah. Thank you.
Thank you for sharing that. And identify yourself, Brad.
I'm Brad Wheats, father of Jag Wheats. My wife Jenna's up there. And our experience is a little different than a lot of everyone's because everyone's going through the end results of it, but we're at the very beginning of it. So obviously it's very hard to be here and hear the things that could be taken from our son. So I just want to, the FDA asks and wants to know like how patients feel. Well, when you get introduced to this disease, your kid is laughing, wonderful, amazing personality, and to think that it can all be stripped away, that's why time is of the essence. And I just want to make sure they know that in the beginning you get blasted with this kind of stuff to see what can happen, and anything we can do to prevent this from furthering as quick as we can would be truly appreciated. Thank you.
Thank you. And let me make one comment. You're welcome to make additional remarks about things beyond the question. We wanted to give an opportunity for people to talk about anything here, but you're welcome to provide any commentary on that, on this or other points. And then Kayla next.
I wanted to
give your name.
Oh, my name is Gene Quant, and I'm here for Ty Quant. The seizures are such a, use the word over again, insidious part of the disease that once you start treating the seizures, you get the complications of the seizure meds. So if you can affect the disease prior to seizures, I think that would be an enormous benefit, because once they have seizures, you now need to be with them constantly. And that's the part that I think most negatively affects me in the disease, or my son and myself.
Thanks, Gene.
My name is Kayla. My daughter Cameron has Niemann-Pick Type C, and she does not have seizures, but she has almost every symptom that is listed up there. When she was diagnosed, she did not show any symptoms other than an enlarged spleen and liver. So for her, she still has to be monitored 24/7, and she does not have seizures. She has cataplexy, but the biggest thing that impacts our lives is her cognitive impairment. And days are up and down. Moments are actually up and down. 1 minute she may understand what we are saying, and the next minute it's like a completely different child. It's like it's taking over. And so that's what is hardest for us in the dementia. Sorry.
Oh, no, that's fine. Thank you. Yes, and if we can raise hands, and Rebecca in the back of the room.
Hi, I'm Rebecca Spencer White. My son, Jonathan Spencer, has Niemann-Pick's, and we've been lucky through all these years because he's had little symptoms except for the liver disease at birth that almost took him, and he made it through when they thought he wouldn't make it through as an infant, and now he's going to be 13 at the end of this month. He's having problems kind of like Alec, where he's repeating himself a lot and stuttering a lot. And I know as a parent, my biggest fear is if we don't find something more, that he's going to have that seizure like Andrew one day and his life is going to change. And that is my ultimate fear. And anyway, I just know that watching all this and being a part of all this just gives us the hope we need to find something soon, and hope you guys will help us.
Thank you. And for those who wish to make a comment, hold up your, very good.
Hi, my name is Wendy McKenzie, and this is my son, Gabriel McKenzie. It's ambulation, mostly. Sometimes it's a cognitive because you can't understand him, you can't reason with him. He doesn't understand abstract thinking, that kind of thing. But, well, he used to dance, and he used to play football. He wasn't allowed to play football because they thought he had a concussion, and his favorite position was on the line. He also held the quarterback sack record in our school, where, a predecessor has made NFL 3 times. And he used to also skateboard, which, because of his balance, he can't skateboard. So he's taken to, he puts his art on T-shirts, but, he still can't get to those places. So he can do those, like art fairs and, just being in the public. So it's really important that we can hold the disease where it's at, and he can still have his hopes and dreams. You want to say something, Gabriel?
No, I'm good.
All right. All right, thank you.
Thank you.
Tim.
Nice job with the sax. Oh, Cindy.
Tim, I want to make one comment, and I have a feeling that this poll is reflective of who's participating. And I think we probably have more current families than parents that have lost their children. I lost 2 children to pneumonias, and I think as the disease progresses, that my experience was that the swallowing becomes so important. And I think if you took a poll of how children died, I think you would find that that's where the majority of children die.
Excellent observation. So the whole risk of aspiration or just of community-acquired pneumonia is really a problem. And that's a great reminder about the importance of vaccination for those where it's possible. Yes.
Hi, my name is Anthony Leone, and I live in Los Angeles. And my daughter's 21, will be 22 on her next birthday. She was diagnosed inside her first year and had onset of seizures at the age of 7. And in getting to know the other Niemann-Pick families, I am amazed by what they have to go through in order to get services delivered to them, sometimes crossing state lines, if not time zones. And we've been the beneficiary of outstanding health care in the greater Los Angeles area, although we've had to access 4 different hospitals at different times and various clinics. I think it's absolutely amazing that folks can travel with their kids and young adults in order to get the treatments that they need. And I hope that the greater medical community can help them access those services on a more local basis. We never made those trips because we couldn't justify the risk-benefit factors in accessing those services. So we weren't part of early trials. We weren't part of early therapies that didn't exist in Southern California. Making those services accessible to other families from locations that don't currently have those services is also very important.
Thank you. And I believe, one more comment. So, Lauren, if you can bring that up, and then we're going to try polling question number 2.
Thank you. I do want to thank Anthony for giving me the courage to stand up. I have 4 children. 2 of my girls were diagnosed with Niemann-Pick about 2 years ago, and my 2 boys are carriers. My girls have very, very different symptoms. All of those symptoms, not all together in one girl. Kendall has Crohn's disease, and it took about 9 months of her having chronic illness for them to find that. She does have an enlarged spleen, and they couldn't find anything while we got diagnosed with Crohn's disease. It wasn't until Kendall has Crohn's disease and the Niemann-Pick, and then Bryn just has the Niemann-Pick. So it wasn't until Bryn had to go through progression and lose a lot of skills for us to be able to get them diagnosed. And while we were in the process, the doctor didn't know until he saw Kendall. When Kendall came to one of Bryn's appointments is when he looked at her and said, "Is that her sister?" And I told him yes, and he said, "She's very distended." So I told him that she had an enlarged spleen, and he said, "This changes everything. I think I know what both of your girls have." And of course, our world came crashing down because we were going for 1 diagnosis and we got 2. Our family is impacted by this in so many ways because of all of these symptoms. I'm sorry. Once they started treatment, which was immediately within 1 month that they were able to start getting the treatment, Bryn got a light back in her eyes. She was slipping away. She got that light back in her eyes. She's now full of energy and runs around. She's kind of crazy. We do have to watch her because she does have seizures and cataplexy. And then Kendall at one point was hospitalized. Her Crohn's disease affects her more, and she almost died. She coded blue. And once we started several treatments, she has multiple treatments. She now is singing, she's laughing, she's dancing, she's walking, she's skipping, she's climbing. I watch my girls and the contagious personality that they have. People are drawn to them. I know you guys heard from some of them. These children are special. There's something different about them. And we want them to keep living and keep going. Thank you.
Thank you. Thank you all for your comments. And we're going to go to question 2, please. And I think this has been an interesting factor in all of our presenters so far, that there are different elements that bring to attention the concerns with a child's progress. So what symptoms first led you or your physicians to consider NPC as a likely diagnosis? And you can select up to 3, understanding there may have been multiple factors. We'll just give it a second for you all to take your votes. And I have a sense that if we had looked at this 10 years ago versus now, there may have been different trends. Hard to say. Very interesting here. So while there's still moving targets, enlarged abdominal organs or neurologic symptoms seem to be the most remarkable. And we don't have a way to ask you on this kind of thing at what age of onset or whether there are other factors involved in what brought to your attention. And this is intended not to be definitive, but just to help with further discussion and to provide information to sponsors and FDA about some of these sentinel signs. Also, just to add a comment, very sensitive to what you've all stated about the fact that depending on the onset of disease, you may not have sufficient warning for siblings for testing. So that's an important factor. We can perhaps talk about screening later. Yeah, so, given this as a topic of interest, you can offer comments about these particular things. I know many of you talked about delay in diagnosis, or you may extend the discussion to other factors.
My name is Barbara Little. I am a caregiver. I actually am a nurse practitioner, and she is my granddaughter. My great-granddaughter, Cameron, was born with an enlarged liver and an enlarged spleen and diagnosed when she was 4 months old. So I have been her caregiver and with Kayla all her life. She and her dad is very much a participant in it, her dad, mother, and myself and my husband. But she was a normal little girl except for the enlarged spleen and the enlarged liver. She had no visible symptoms at all. She knew all her colors, all her letters, all hopped and skipped and sang and knew all songs. And then about 4 years old, close to 4 years old, she would only say one word. She developed symptoms extremely quick. She was not really expected to live to be 5 or 6 years old. But she started treatment every 2 weeks at 4 years old. And almost 5, 4 years old, 4. And she has still continued treatments every 2 weeks. We moved them to a place close to our house now. And even though she has and had all those symptoms at 4, the symptoms themselves have improved. She went from saying one word to a sentence. Sometimes she garbles, sometimes it depends on where she goes in and out. But she can say, I would like to watch Shimmer and Shine. And, she can, from going from totally introverted, she was, she'll say, what? Let her try that. Let me do it. Let me do it. Very independent. She exhibits now, she's 7.5, and she no longer acts like a little child anymore. She acts age appropriate on a lot of things. Not everything totally, but she's very age appropriate on a lot. And she has improved with her speech, she was this way at 4. She no longer has fine motor movement tremors. She has her walk. She wears braces now, but she still walks and runs. And she had numerous hospitalizations with lung problems. And for some reason, that has improved. I'm from hearing everybody talk, I don't think that improves. A lot of times I don't know, but hers has. She has and so I can say that with treatment, she has improved in lots of symptoms, but she does not have, and she has a little mild enlarged liver now, but no enlarged spleen. So she has improved. It may not be 100% or even 20%, but it's a quality of life for her. And she's a loving, loving little girl, and she became non-affectionate, like almost like autism completely, to an affectionate little girl now. So you can see all of the quality of life for her has improved greatly. And her life that was supposed to end at 4 or 5, now she's almost 8. So it's been a wonderful, wonderful blessing for us to have had her in that length of time. Thank you very much.
Thank you. And I'm sure a lot of us are also envious as well, knowing you have great grandchildren and that many of us may not have such a privilege. Huh. Good fortune. Yeah, Rebecca in the back and also this gentleman here. Oh, I'm sorry. Oh, Debbie, please go ahead. Then Rebecca, then you.
Hi, my name is Debbie Kaflowitz, and I just want to say something on behalf of my daughter Rachel, who lived to age 33, and other adult onset Niemann-Pick families. The symptom that we dealt with for 12 years and kind of led us to something else is wrong is actually not on there, and that was the psychological symptoms. Rachel was diagnosed as bipolar and lived with the diagnosis for 11 years. Within that time, it got to psychotic, and then it got to schizoaffective. But the doctor was convinced after a while that it was either she had two things or she never had bipolar to begin with, because her loss of memory was very puzzling. And I always say that we got our diagnosis in 11 years and 5 minutes, because our doctor went to a convention that he went to every year at CHOP for psychiatrists, and he especially went to a session called Genetic Illnesses That Mimic Bipolar. And in the middle of the speech, of the presentation, he texted me and said, "They just described Rachel. I'm finding you a doctor and you're going to come here." So for 11 years, I searched for an answer, and there was nothing. The doctor who saw her at CHOP had a letter from me and a letter from the psychiatrist, and as soon as Rachel came in, he tested for the vertical gaze palsy. And I knew that was the answer when he said to her, "Okay, now do it without moving your head." And I hadn't seen her head move. And then he held her head and did it again. And then he looked at us and I said, "I think I know what your daughter has." So there is I have a feeling there are a lot of young adults out there who are diagnosed with psychiatric conditions who really that's not all it is. And that word has to be gotten out to psychiatrists, psychologists, people who deal with older children with psychotic things the doctor kept saying, I should be able to get her better, because she never got quite stable. And then six months later, the medicine would stop, and we'd have to try new things. So that's an important thing for the adult community to look at.
The kids can't tell you.
No.
Thank you. Rebecca?
Rebecca again, and my son is Jonathan. I just wanted to bring up the fact of liver and spleen disease. Jonathan, at birth, that's when he almost passed away, and they told us that they thought it was meningitis, but they weren't sure because he was in complete liver failure. And he had 4 platelet transfusions because he had absolutely no platelets. We were in the hospital for 2 months. He started the transplant list for a liver transplant. We didn't know what was going on, but they kept referring to it as if he passed away, it would have been meningitis on his certificate. And I think that might happen to a lot of kids, is they're misdiagnosed and we're missing them at birth because of the enlarged liver and spleen, because he was neurologically perfect. It was just that. And now that he's getting older, we worry about his liver again. But I just wanted to bring up that point that, I think a lot of children pass away at birth because of the liver disease.
Hi, I'm Jonathan Jacoby. My son, Joshua, was diagnosed when he was about 5 months old because of an enlarged spleen, and he's almost completely asymptomatic still. He's 16 years old, and so on one hand, I feel very fortunate that we happen to, have been at a hospital where the geneticist knew about lysosomal storage diseases and was able to diagnose him. I don't know whether he has adult onset because he has so few symptoms, or whether he has late juvenile onset because he's been on treatment. I sometimes feel guilty. I sometimes feel like, nobody understands because he seems so normal. It basically ended my marriage because there's so many different ways. We had such different ways. I'm confused. I don't know how and when to talk to Joshua about it. I see that he has that spirit that everybody else talks about and that I've seen in the people who have Niemann-Pick Type C disease, and I'm so grateful for that. I feel very, very blessed that when Joshua was diagnosed, one of the best things that happened was that I was able to meet the people who back then were already veterans of this and really embraced me. And as horrible as this is right now, to have to be in this room on some level, it's so great to walk in and to have people to hug who really understand.
Sarah, well.
Hi, my name is Sarah McLaughlin, and my daughter Marion is 3 with NPC. And I just wanted to quickly comment that when she was a baby, she was flagged as possibly having a lysosomal storage disorder. And I specifically asked her doctors, who were wonderful, could it be NPC, because of some of the deep diving I had done. And none of them thought that she actually did have NPC, because she didn't present with any of those symptoms other than a low muscle tone, some mild to moderate developmental delays with gross motor, and enlarged spleen. And they all told me that she didn't have it. So I think I wanted to raise that point.
Thank you very much. And this has been a rich discussion, and I also recognize I'm standing between you and lunch. And there's been a lot of energy expended here. Let me make just a few comments. Obviously very impressing and moving, and one of the challenges is always translating some of the variations into measures that are predictable, that one can follow through. So I'll close this with a note of sadness, but also of great optimism. So to me, the sad part of this is these stories. The word I wrote down was terrorist, insidious terrorist, and it may manifest neurologically or in abdominal organs, but it's entirely unpredictable and relentless and so disturbing. And the other thing that gives me sadness is knowing that you all have a lot greater command of the medical language related to this disease state than I ever got exposed to in medical school or residency training. And I think that's unfair to all of you, but I applaud what you've done with that, and that helps you help others translate some of these findings. And finally then, I'm very encouraged, because having lived over 3 decades in the drug development process, I can remember in my early internship days seeing what was going on with various childhood cancers, as an example, and really distressing and hopeless situations. And now the therapies there are absolutely incredible and alter survival. And not only that, what we see, and we've had opportunities working with other childhood rare diseases over the last few years, where 5 to 10 years ago, there were no therapies and nothing available, to now where we have approved drugs and lots of new research going forward. So I think despite the frustrations you all have, there's great cause for optimism, and this is the kind of session that helps catalyze a lot of that.